Under the direction of orthopedic surgeon Patrick St. Pierre, the Eisenhower Desert Orthopedic Center Sports Medicine Program serves the athletic needs of the community. Sports medicine specialists not only care for sports teams, but also tend to the special needs of athletes of all ages.
Sports medicine is really directed towards the care of the athlete. It can mean a lot of different things. In real terms, it means taking care of sports teams. So there are primary care sports medicine doctors, there are orthopedic sports medicine doctors, and we take care of teams such as high school football teams, colleges, professional teams. And then there's also the sports medicine that relates to everybody else, which is helping people with their exercise programs, helping them with injuries that might occur in the gym, working out or hiking or playing tennis or playing golf.
The sports medicine program provides coverage to many of the local schools and sporting events in the area, covering professional golf, tennis, baseball, as well as high school and collegiate sports programs.
We have started to bring together a group of people to help develop a sports medicine program throughout the Valley. I'm the director of the program, and also Dr. Stephen Steele, who is with us at the Argyris Center, is also deeply involved in the program. And we're taking care of professionals. We take care of the BNP Paribas Tennis Open. We take care of professional golfers at the Kraft Nabisco and the Bob Hope. We also take care of students at COD, take care of the football team, and physicians within Desert Orthopedic Center take care of a number of high schools throughout the area, to include Palm Desert High School, Palm Springs High School, Xavier High School, Desert Hot Springs, Cathedral City.
Two of the most common sports-related orthopedic issues are rotator cuff and elbow injuries, especially for those who play tennis and golf.
Well, shoulders run a gamut of a number of different injuries, from young people who have clavicle fractures from falling down and breaking their clavicles. Shoulder instability is something that we see in teens and 20s. And then we start seeing rotator cuff problems, which are very common around here, and generally in the 30s, 40s, 50s, and 60s. Once people get to be about 40 or 50 years old, then they start developing arthritis, and then people can develop arthritis just as they do in the hip and the knee, and those patients often need arthroscopy or even joint replacement.
Physicians can often treat muscle and ligament injuries without surgery, using platelet-rich plasma injections.
These platelets have a lot of growth factors, and if we can condense these growth factors at the site of injury or repair, then they'll help that tendon or ligament heal. So there's a number of places that we're commonly using that. I use that in tennis elbow for tennis elbow injuries that may have a small partial tear, or they just have what's called tendinosis, which is injury to the tendon. But the body's blood supply doesn't get to that area well enough, and we have to help it heal. So the platelet-rich plasma is injected at that site, and these platelets go there, and they have a number of growth factors that are released and activated, and they help the tendon heal.
Eisenhower Desert Orthopedic Center physicians perform more than 800 joint replacements each year, putting the center in the top 1% in volume of joint replacements performed in the United States by a single orthopedic group. One new area of joint replacement specialty at Eisenhower Desert Orthopedic Center is reverse total shoulder arthroplasty.
In patients that have rotator cuff failure and their rotator cuff is completely torn, they'll develop arthritis in their shoulder joint. But we can't replace it with a standard total shoulder replacement, because the rotator cuff can no longer keep the ball centered in the socket, and now the ball is going to jam up into this bone. That's very painful, and then the patient cannot raise their arm. So what we've come up with is what's called the reverse total shoulder arthroplasty. And the reverse arthroplasty takes the scapula, and instead of putting a cup where the cup used to be, we now put a ball. And as you can see here, here's a ball that's metal, and it's attached to the shoulder blade by these screws, which are very strong. And then the bone will grow into that also to make it secure. On the other side, when we cut off the head with the arthritis, we now put a cup. We still have a stem that goes down the canal, as we said before, and then now there's going to be a cup. So now the cup will keep the humerus below and not let it hit this bone. So when you try to raise this with the deltoid muscle, the ball is still keeping that socket down so that it can't go higher. And now patients can raise their arm, and it's amazing how well their function is, even though they don't have a functioning rotator cuff.
Reversing the ball and socket changes the mechanics of the shoulder to improve active range of motion and strength. As a result, a patient can raise his or her arm higher and even overhead. This patient had both shoulders replaced.
Oh, I feel fantastic. I played golf yesterday. I'm going to play tomorrow. I feel great. I have no problem at all. I have tremendous range of motion. I can scratch my back with either hand or either arm and have no pain at all.
Full elevation there.
Physical rehabilitation is a vitally important part of the healing process. Dr. St. Pierre has developed a series of simple yet effective exercises that patients can do in the doctor's office or in the comfort of their own homes.
And the reason this is working because it's stabilizing your shoulder blade. And it's allowing your motion in your shoulder joint to actually take place, but you don't have to raise it against gravity. We're using gravity to help us instead of hurt us.
One of the things I've been working on is a home physical therapy program for my shoulder patients and also for patients with shoulder injuries. And we've developed a specific number of exercises involving common things at home.
We want to squeeze back and pull those elbows straight back to the back wall, and we want to strengthen these muscles right back here, okay? So you want to keep your shoulders down and squeeze right here. You want to feel it right in these muscles right there. And that's going to help stabilize that shoulder blade so that the rotator cuff can function correctly.
These exercises included what's called wall slides, where they slide their hand up the wall and then we have them lift their arm off the wall and they can do that appropriately. And the patients can work on regaining their motion and strength at home, which they can do on a daily basis instead of just relying on the therapist 2 or 3 times a week.
Coming up, back pain affects 80% of Americans. Find out what you can do to protect your back and the latest treatment options for back injuries.